A good candidate for a cochlear implant is someone who has severe to profound hearing loss in both ears, that are wearing hearing aids and aren't quite getting the full benefit of the hearing aids. They're still having trouble hearing one-on-one in quiet situations. They're still having trouble listening on the telephone. They have to have the captions on to understand television. That would be a good candidate.
Cochlear implants were first developed in the late 70s and early 80s and have improved dramatically over that time. Over the last decade or so, they've gotten a lot better with computer processing and digital technologies. We started the cochlear implant program here at Holland Hospital about 3 years ago and have done 11 implants since then with great success.
The diagnostic testing that we do to determine if someone is a candidate, we'll do the standard audiogram, which includes listening to pure tones and repeating words. From that point, we'll go on to do the cochlear implant testing, which is currently the ASBio test, and based on the test scores, we can tell you whether you're a candidate for a cochlear implant or not.
I was born with a hearing loss, and my parents didn't find out until I was about 3, and ever since then I've been wearing my hearing aid, and then about 2003, and that's when I found out that I had this disease that eventually I'm going to be going completely deaf.
Lori came to us with a history of lifelong hearing loss, and although she had been using hearing aids for quite some time, she still was having a significant difficulty communicating. She had a unique abnormality of her inner ear, but was still able to undergo a cochlear implant.
Then just last year, my hearing was really getting bad. The hearing aid was no longer good for me, and I said, I'm ready for a cochlear implant, and I want to go for it.
The surgery itself takes about 2.5 hours or so. It's an outpatient procedure.
I had my surgery September 15, 2011.
She had the surgery without complication and did remarkably well. After her implant was placed, she was able to hear within the first visit or two after programming, and has been doing remarkably well ever since with conversational speech, much better than she had when she was using her hearing aids.
It is a lot different than having a regular hearing aid, because cochlear implant, you hear a whole lot more things. It's amazing, because there's a lot of other things I've missed out so much just wearing a regular hearing aid.
And she now is just doing great with the cochlear implant. She can hear birds, her cat's purring. She was very surprised to hear that they made such a sound.
I'm hearing birds everywhere now, and I never had before. It's like, I didn't realize the birds are noisy, but I enjoy every minute of it when I do hear the birds.
From the patients that we've worked with here at our office, we have seen numerous improvements, and just the quality of life has skyrocketed for these patients. The same tests that we perform pre-surgery, we perform in about 6 months to 1 year after, and some of those improvements we have seen have been marvelous. From 20% to 70, 80%, that's life-changing. It's a miracle.
The process of being evaluated for and having a cochlear implant is actually remarkably easy. The evaluation involves a number of audiologic tests similar to a hearing test that many people have already had. The surgery itself has very few risks, and the success rate is remarkable, and the effects that it can have on someone's life and ability to communicate can be profound. The entire process of cochlear implantation is available here in Holland. If you call our office, we can set up appointments for the audiologic as well as the surgical evaluation, and the surgery can be done here in Holland as well as all of the rehabilitation and programming and training thereafter.